dear students, welcome to the class on corticosteroids part 3. We'll discuss about glucocorticoid actions in today's session. So coming to the specific learning objectives, at the end of this class you should be able to explain the carbohydrate and protein metabolism, fat metabolism and anti-inflammatory effects associated with glucocorticoids. So coming to the glucocorticoid actions on carbohydrates and protein metabolism, as we know that it produces anti-insulin effects. It means to say these glucocorticoids will increase the blood sugar levels, leading to hyperglycemia. And it also promotes the hepatic glycogen deposition. So these are the two main actions of glucocorticoids on carbohydrates. Let's see how this mechanism will occur. So coming to the anti-insulin effects. So basically it increases the blood sugar level. The reason for increase in blood sugar levels are it decreases the peripheral glucose utilization. The reason being the glucocorticoids will decreases the cellular uptake of the glucose. That's why there will be increase in the blood sugar level. So other reason being, so the glucocorticoids will increase the hepatic gluconeogenesis because of the stimulation of the glucose synthesis from the amino acids. And third reason being because of the mobilization of the amino acids to the glucose synthesis pathway. It is mainly due to the inhibition of the protein synthesis in the muscle, connective tissue and skin. So you can say the glucocorticoids has got anti-anabolic action. So next is it promotes hepatic glycogen deposition. It's mainly due to the induction of hepatic glycogen synthetase enzyme. So what will be the net result of glucocorticoid administration? It increases blood sugar level, it increases the liver glycogen deposition and it increases the excretion of urinary nitrogen because of the protein breakdown. So what happens if there is a prolonged and high dose of administration of glucocorticoids? So it will create a diabetic-like state or diabetic-like condition, and also it leads to the protein wasting because of the breakdown of the proteins. So coming to the physiological role played by glucocorticoids. So it is during the two conditions like starvation and malnourishment, it has got protective action, especially it provides the glucose to the glucose dependent organs such as brain and heart. So coming to the fate of fat metabolism with respect to glucocorticoid action. So in the adipose tissue, these glucocorticoids has got permissive action where it produces lipolytic effect, and it also enhances the lipolytic effect produced by growth hormone, adrenaline and thyroxine. So the presence of glucocorticoid is a must for growth hormone, adrenaline and thyroxine to produce a lipolytic effect. So what happens when there is a lipolytic effect? There will be mobilization and there will be increase in the free fatty acid concentration. So next coming to the glucose utilization. So glucose utilization is inhibited in the adipose tissue as well as the muscles, leading to hyperglycemia. So hyperglycemia will lead to increase in insulin release. So net effect will be there will be increased deposition of the fat. So coming to the what happens when the glucocorticoids is used for long term at a high dose. So there will be redistribution of fat from periphery to the central. So there is a redistribution of fat from peripheral stores to the central location. So whatever the fat which is stored in the subcutaneous tissue or the extremities will be lost and it will be getting deposited over the face, neck as well as shoulder. So you can see since there is a deposition of fat into the central area, it will lead to central obesity and patient can have a broad purple stretch marks, and also the skin becomes thin and brittle. And due to the deposition of the fat on the shoulder and neck, it will create a buffalo hump, and it will create a moon-like face and fish mouth appearance. So coming to the redistribution of fat, why it occurs? So in the peripheral adipocytes, we know that the peripheral adipocytes are very less sensitive to insulin, and they are more sensitive towards the corticosteroid facilitated lipolytic action of growth hormone, thyroxine and adrenaline. So thereby it will lead to breakdown of the fat. So fat breakdown will be predominant in the peripheral adipocytes. So thereby whatever the fat which is broken down in the periphery, it will be mobilized into the central location. Whereas when we come to the truncal adipocytes responds only to the raised insulin levels which are caused by the glucocorticoid induced hyperglycemia. So next, coming to the third important action, that is anti-inflammatory effects of glucocorticoids. So we know that endogenously the glucocorticoids helps in prevention of the stress, infection and inflammation, whereas when we give exogenously, so when we give the exogenous glucocorticoids, it will help in treating the unwanted inflammatory effects as well as the immune response. So it has got two entities or two component. The glucocorticoids has got early component, which is mainly responsible for inhibition of edema, pain, heat and fibrin deposition, and the second component being the late component, which causes the retardation of collagen synthesis and it retards the wound healing. So it will retard the wound healing process. So what happens when there is a prolonged use of glucocorticoids? So on prolonged usage, the glucocorticoids will suppress the protective action of the endogenous glucocorticoids. That is, it will going to suppress the it will suppress the protective response, like anti-inflammatory action will be lost, and the protection against the infection is lost, and also it delays the wound healing as well as the repairing ability. So what are the applied aspects of glucocorticoids? So it has got anti-insulin effect because of the hyperglycemia. Since it creates the diabetic-like state, you should be very careful in diabetic individuals. And also this hepatic gluconeogenesis, mobilization of the amino acid that will help in increasing the glucose synthesis, and hepatic glycogen deposition will all can increase the glucose level, and you should be very careful in case of diabetic individuals. And also it leads to protein wasting because of the inhibition of protein synthesis as well as breakdown of the proteins, and there will be mobilization of the free fatty acid due to the lipolytic activity. Net effect will be increased deposition of the fat in the central area. And the anti-inflammatory effects, you should remember the early component has got beneficial effect because of inhibition of the pain, heat, etc. And also it decreases the edema, whereas late component will going to retard the collagen synthesis as well as deposition, and it will delays the wound healing. So one should remember that it will lead to redistribution of the fat from peripheral stores to the central location. So this is my reference. So in next video we'll discuss about the glucocorticoid action on immune system, calcium metabolism, CVS effects, hematopoietic system, CNS and miscellaneous effects. So thank you. If you like this video, please do subscribe to my channel. I love pharmacology for more updates on pharmacology. Thank you.